welcome to my channel Nursing Made Easy. Today we are going to discuss about the second part or the second series of this aptitude test practical. So today I'm going to discuss about a station which they are going to assess your technical skill. So they are going to tell you to do some of the procedure. So that's what they are going to do. I will tell an example of the station. You may get a patient with a chest pain, chest infection, and they will ask you to give nebulization, saline nebulization for that patient. So that means here your task is to give nebulization. So they are going to assess your skill, how you are giving that nebulization. That's your task. So in that station, what all are the things you have to do? First of all, what you should do, you should read what you are going to do. Okay, so you have to read properly. As I mentioned before, in your doors, like where you're doing the examination, in the door, they have mentioned the scenario. Scenario means the situation. They will explain the situation in detail and they will write the question, what you are going to do. What you are advised to do will be there in a point, like 2 or 3 points will be there. So the same question you have to read properly and you should understand what you have to do. Okay, here I just give an example like a patient with a chest infection and they are asking you to give nebulization, saline nebulization. In that, when you are entering to the patient's room, first of all, what you have to do, you should introduce yourself and thereby you are maintaining a therapeutic relationship. You are making familiar with the patient. So you have to be very humble and you should be with a smiling face and you should tell, yeah, I'm so and so and I'm a nurse. I'm here to help you. Like that you have to tell. And here they have mentioned like the patient have chest infection and you have to give the nebulization. So what you have to do means, first of all, you just introduce yourself and you will tell the patient like, I will give you the nebulization so that you will become more better. Like that you have to explain to the patient and you will help the patient to sit in an upright position because we can give the nebulization only in the semi-fallows position, or you can make the patient to sit in the chair. Whatever is comfortable, you can tell. You have to explain to the patient like, if I want to give the nebulization, you have to sit upright. So I will help you to sit upright like that. You can assist the patient to sit upright, or you can tell if you are okay, you can sit in the chair. So when we are sitting in the upright, that's the best position to give nebulization. So you will be okay. So your examiner is going to act as a patient with chest infection. Okay, in between they may ask some question to you, like they may express some concern. If they are expressing some concerns, you have to console them. You have to act like a real nurse. So in a real situation, what you are going to do in a confident way, just tell. That's it. That's what they want to see. Okay, yeah. Then next, so you prepare the patient for the procedure. The next thing you have to do is you have to check the cardex because they ask you to give a medication. Saline nebulization, it's a medication. So you have to make sure it was documented in the medication cardex. Cardex means the medication chart. So the nebulization is there. So how much we have to give, saline nebulization, how much we have to give, and the frequency and the signature, everything you have to check in the cardex. So when you are checking the cardex, maybe the examiner may not understand you are checking these all things. So it will be better. You can tell like, yeah, it's there in the cardex, saline nebulization. The name is legible, signature is there, date is there, frequency is there. So I can give, I'm going to prepare the nebulizer. So like that you can tell. And before going to the nebulization, what you have to do, you have to maintain the universal precaution, wash your hands. So you have to wash your hands or just explain to them, I'm going to wash your hands before preparing the saline solution. Then later on, you have to go to the place where the nebulizer is situated. So they might have kept in the corner of the room. So you have to go there after washing the hands, have to go there and go and prepare the saline nebulizer. And after that, you have to take that trolley or just a nebulizer, whatever is the situation there. So use your common sense and take that one and keep it in the side of the patient or bedside. You have to take that trolley to the bedside, and again you have to explain, yeah, now I'm going to give the nebulization. This is a saline nebulization. It will give you if you put this one, you will feel much better. So can I put the nebulizer, the mask or nasal prong, whatever it may be. So you have to ask the patient, can I put that one? Then patient will tell you, yeah, yes, nurse, you can put. Then put the mask and turn on the nebulizer. So maybe they won't ask you to turn on because there won't be any real patient. So that's what you have to do. So if they are going to assess your technical skill, you have to do that one properly. So every time you have to remember about washing hands like universal precaution and maintaining a therapeutic relationship with the patient. How you can maintain therapeutic relationship? By talking. Just talk to them. Talk freely. Just explain everything. Whatever you're going to do to the patient, explain to them. Smile. If they are telling some concern, give reassurance for them. All those things you have to be careful while you are attending the practical examination. So that's all for the technical skill station today. I hope this video is useful for you. If you find this video useful, please share with your friends. And if you are new to my channel, subscribe my channel and press the bell icon so that you will be notified with my new videos. So that's all for today. Bye-bye. See you with another video.